Welcome back to the Academy Table. I'm Renee De Silva, CEO of the Health Management Academy and your host. I'm happy to have you back with us again. Recently, I had the pleasure of sitting down with Gene Woods, President and CEO of Atrium Health. Much of our conversation focused on health equity and the many approaches Gene and Atrium have leveraged to close gaps, including within their COVID response, community partnerships, and investments, along with a host of structural changes in the executive suite. I'd like to bring your attention to a few key takeaways. First, I love how Gene has applied a moonshot lens to solving health equity. Essentially, how do we invoke the same ingenuity and collaboration that landed us on the moon to eliminate health disparities? Next, listen for how he articulates the role of personal storytelling when engaging others on potential sensitive issues like race and racism. And third, Gene serves on the board of Best Buy. In recent years, Best Buy has pivoted to deliver an omnichannel, fully consumer-centric product. His insights here are particularly valuable for health system transformation post-COVID. Lastly, I enjoyed getting to know Gene. Of course, we know him as a driven and innovative healthcare leader, but I learned about his talented musical skills. His thoughts on the power of music and art carry meaning for everyone, even if you're like me and your outlet is just mediocre, really bad karaoke. So with that, let's head to the table. Good morning, Gene. Welcome to the Academy Table. Really happy to have you.
Good morning. It's great to be here with you.
I appreciate you joining me. I have been looking forward to this conversation and want to get into just all the great work that you've been doing, particularly around health equity. Before we do, though, give us a little bit of a sense for your background and maybe some of the early forces that shaped you.
Sure. Well, I guess the way I would start by describing my family is sort of like the UN, the United Nations. My father actually grew up African American. He's from a rural town in Tennessee, and he joined the Navy. Met my mother over in Spain. She grew up in a town in southern Spain called Jerez de la Frontera, Andalusia, the southern region there. And then the mother of my kids, she was half Mohawk and half Dutch Irish. So I think in many ways we reflect the rich tapestry of this country, if you will. And I think that has shaped a lot of how I lead and really how I interact with all kinds of people, and whether rural or city, and of all different kind of backgrounds. In terms of what shaped me and sort of what led me into healthcare, there's a couple of important moments in my childhood. One is that my aunt Carmen, one of my favorite aunts, when we were in Spain, she actually was admitted for severe headaches and ended up, there was a medication error, and that resulted in her death. And so that I kind of saw the worst, if you will, of healthcare. And then when I was about 9 years old, we were involved. My mother was driving. It was her, my sister, myself, my aunt, and my uncle in a car. We were actually going to the beach on a beautiful Sunday. And the car malfunctioned, and we hit a brick wall going up probably about what would have been about 70 miles an hour. None of us should have made it out of that car. And my recollection, even at that young age, was that all of a sudden we were surrounded by what felt to be angels. They were there rescuing us and taking us to the hospital. And so I kind of saw I thought the not great side of healthcare and the best side of healthcare, as we always say, and then what we've seen in COVID, when people are running from the fire, we're running towards it. And so I think that really, as I've progressed through my 30-year career, those two experiences have stayed with me.
Wow. And you said you were 9 in that when that car accident happened. So that was a really early force where you were able to really see healthcare at its best. And it sounds like that stayed with you. That's a pretty powerful story.
Yeah, absolutely. And we ended up at different hospitals. And the main thing is I remember getting to the hospital. It was myself and my mother with the hospital. And my main thing is really was worried about everybody else, and the caregivers were so as a young kid were saying they're okay and explaining things to me. So that's that compassionate care is something that I appreciated when I was a kid, and certainly we try to emulate as Atrium Health today.
That's great. So you studied at Penn State in college, and it sounds like you landed in a healthcare administration orientation session. And maybe put you on the formal path. Is that a good way to think about it, or how would you explain that?
Yeah, exactly. I mean, actually, when I went into college, I had no idea what I wanted to do or be. I was the first, actually, in my family to go to college, and I speak Spanish fluently, and I knew that I kind of liked business because early when I was a teenager, I was part of the junior JCs and learned a little bit about how to make things and sell things. So that was sort of, I went there vaguely thinking that might be something I wanted to do. I got family that's international business, but I mixed up the days, the career days, and it was local hospital administrator talking about that they needed young, bright minds really to transform healthcare, and they really literally had me at hello. I signed up for the Penn State Health Planning Administration program right then and there, and it's led me to today.
That was a happy accident.
It was a very happy accident.
Yes, yes. I remember for me, my first job in high school was working in the main kitchen at Rhode Island Hospital, which is where I'm from. And you'd have to, as part of that, deliver meals to floors. And I remember at that time just being so struck by the flurry of activity that always was anchored around a hospital setting. And just at that point, just really being curious about what that could mean. And I recall vividly, probably in my late 20s, going back to that hospital that I was serving food in the kitchen and meeting with the hospital CEO related to some work that we were doing with them for the company that I worked with at that time. And I just felt like, wow, what a full circle moment in terms of how all these things can come together. So your story definitely lands with me.
Yeah, it's amazing how those things can shape you in ways that you don't fully anticipate at the time. And by the way, I'm also from Rhode Island, so we share that in common.
We do. That's great. Okay, so Atrium, I know that recently, and your commitment to, and I love where it comes from in terms of seeing healthcare being delivered from the patient lens, wanting to make sure that you can create that experience for the patients and populations that you serve. You recently had a congressional testimony where you talked about the health equity moonshot. And I think the way that you framed it was this notion of watching COVID having such a disproportionate impact on people of color and feeling a sense of personal accountability and being really animated around addressing that. So I'd love for you to just talk more about how you think about a health equity moonshot. What does that look like to you?
Yeah, well, first of all, I think this past year, as we all know, it was a time for us as healthcare providers to demonstrate that our mission was real, not just words on a page. And the only way to do that is really through action, really engaging deeply in those communities that were being particularly affected. And we've known for so long that there's deep disparities in both rural and urban communities that we need to solve for. It's just that it really, really came to light during COVID, where people of color were being affected. Sometimes we're dying at 6 times the rate of the majority population. So, and part of in that testimony, what I shared is that the major components or the root causes of health inequity could be similar, whether you're a poor African mother in New York or Hispanic farm worker in Texas. It's throughout the country. And I think the fundamental call to action that I shared in the Senate was it did take us less than a decade to put Neil Armstrong on the moon. And doing so really required this tremendous collaboration, ingenuity. It really showed who we were as Americans at our very best. And so many phenomenal things came out of that moonshot, if you will. And really my call was that we could apply the same level of collaboration and ingenuity in these times. If we could do that, we could eliminate health disparities by 2030, whether in rural and urban communities, if we collectively took this moment in time to say, not on our watch, which is the approach that we took in our communities, that if there was testing disparities, we were going to be there working with the churches, working with other community groups to say, how do we make this different right now? So I think that's the kind of orientation we bring to it. We call it our For All mission. Health, hope, and healing for all. And I'm really, really proud of how this organization stood tall in this moment through actions that our mission was real.
Yeah, I want to talk a little bit about your specific response to it. But before I go there, when you think about, we've been doing some work at the Academy around this too, around how do you think about building a health equity platform that can make these bold moves and try to really move the needle on closing gaps in outcome. Let's just talk about the components that you believe need to be really part of that strategy. So you talk about the importance of data sets that help us get to real-time analytics around that. Just maybe activate a bit more around the components of a platform that you think would be most helpful in trying to close that gap.
Yeah, well, I think first, we talk a lot about the tone at the top. It does really start there. And so CEO and the board have to be on the same page that that's important to the organization. And I think that's, and what we did last year as we were working through the heat of the pandemic, we really said that, and on the heels of George Floyd's killing, we didn't want to 2 years from now then forget what we've gone through. And so we really wanted to embed structural components into our system to make sure that this was something we'd be committed to even well beyond my tenure. And so we did set up these governance structure. The board chair, myself, co-led a committee, highest level of governance, to look at every single aspect of the organization and how we can continue to get better. We called it our 2.0 version of our For All mission. And so we now have, as part of the enterprise, every single board committee, every single one in it has a social impact part of their charter. For example, if you look at our investment committee, we have very significant investments. We've moved over $250 million of our investments, and we're continuing to do more into Black-owned equity firms, for example, to create entrepreneurship and wealth and things of that nature. So it's really covers every single aspects of governance. And so it does start there. I think the other thing you mentioned, data. Data is just so important in everything that we do, but we really realized early on that we had this ability to geospatially map our communities down to the zip code. We knew in the middle of COVID what the median income was the testing distribution, what the mortality rates were in diabetes and rates of other diseases. And so we really used that, for example, with our roving medical vans to go into those communities. Rather than a shotgun approach, we knew exactly where we needed to go to eliminate testing disparities, for example. So I think the learnings in COVID were that the data needs to be actionable. And I think we demonstrated that in many ways.
Yeah, your last point on this sort of geo-mapping, I've heard you, or at least read some of your thinking around that. So oftentimes I think we think about zip codes being maybe the way in which we map this. I think your team built something that was even more detailed around social vulnerability indexes and use that to guide interventions. Any more that you would say about that in terms of really how you all thought about that? I think that's an interesting way to get laser-like focus and figure out where the interventions can lead to the greatest outcomes.
Exactly. Well, I think all of us realize that the public health infrastructure of this country has been significantly underinvested in, and it really showed, although public health organizations throughout the country really did whatever they could, we weren't able to get that type of data from public health, nor, quite frankly, the state governments and things of that nature to be micro enough for us to be actionable. So we had developed over time that capability, made some significant investments in that several years ago, but this is really where we were able to use it in a very, very direct and quick way. So I think it really comes with understanding the community. Now, the data is one thing, then you've got to figure out in those communities the type of relationships that you have. So there's a group of pastors that have come together in an organization, about 60 different churches. And so once we had the data on what neighborhoods were being most effective, then we connected directly with them and really formed a partnership in the middle of this that will sustain us going beyond this. So I think we realize the data is critical, and we're continuing to invest in that data capabilities for rapid cycle deployment on access and health, but those relationships that we built also, I think, are as important as anything as well.
Yeah, so great example of meeting people where they are, and then able to then be quite real time in terms of the interventions that you deploy. It sounds like for Atrium that translated into closing the gap on testing within Black and Brown communities. And also, I know that you all have done some more interesting work around extensions of that. So talk a little bit about how you're thinking about hospital at home. I was particularly struck by your comment, which I think sometimes gets lost in this dialogue around the urban and rural needs are not that different in terms of access and needing additional resources. So talk about how you've thought about some of these broader strategies through that lens.
Yeah, well, they say necessity is the mother of invention. Early in the pandemic, everybody was trying to deal with bed capacity issues. And we realized that we were thinking about building actually out a field hospital here. We realized that FEMA had all their resources appropriately diverted at that point to New York and other hotspots. And we were climbing, but we didn't have the numbers they did. And we realized if we were going to if we were going to have to lift up a field hospital, basically at a time when personnel was short and PPE was short, we were going to have to sort of rob Peter to pay Paul. So we decided that wasn't the right approach. I asked a group of our clinicians and administrators to come to give us some options. And that's when the idea of a hospital at home that we've been invested in telehealth for the last decade. So we had those capabilities. We have a paramedics program here as well that they said, well, we use our telehealth capabilities, add some additional monitoring technology, use our paramedics to go into the home for any interventions. We actually can care for people at their home. And so that's what we did. So far, I think we've cared for close to 60,000 people in their home. If you would have asked me last January that today I could say that it just wasn't within the realm of our thinking. And the people at home, actually, if you looked at the last numbers I looked at, about 30% were people of color. And then that sort of allowed us to cover a much broader geography, rural and urban alike, because we had these capabilities. And at one time, I think we were taking care of, just in telehealth, about 130,000 visits a month, plus all the work that we're doing from home health. So those are the things that I think are inventions in the middle of this that will serve us going forward. We also at the time had direct conversation with HHS because they were trying to figure out, so how do we pay this and what does this mean? And so to their credit at the time, we really explained what we were doing and how it was something that was going to be applicable in the future. And I know there's still work going on that, but early on, I got some collaboration and understanding that really helped us as well.
I think that's fantastic. How do you think about that also in terms of the voice that you're bringing to ensuring that there's sort of equity in broadband and all the other sort of fundamental infrastructure that's required to really deliver that at scale? Do you worry that some of the expansion in telehealth and other remote technologies also could maybe lead to widening the gap in healthcare access?
Absolutely. I mean, I think we know that the digital divide has impacted and created unequal access, not just in health, but in education and so many other ways. So through our government relations program and our advocacy efforts, we're strongly speaking with legislators and the governor that I had a conversation not too long ago. So how do we help bridge that divide here? And in Charlotte area, we actually worked with the CEOs here from Bank of America, Honeywell, Lowe's, and others, and really helped work with the local school district, the public school district, to help close some of that divide, because we said don't have access to school, that's an issue, but then the same mechanism doesn't allow that family to have access to health. So I think we made some progress, but I believe obviously there's a lot more to be done.
Yeah. All right. I want to transition a bit to just the board conversation that you hinted at a moment ago. So it sounds like you've done a significant work to ensure that equity and inclusion is embedded into all parts of the enterprise, including your board. I also think, and you correct me if I'm not accurate on this, but you also have a committee of the board who is really focused on diversity, equity, and inclusion as a standalone committee of the board. Do I have that right?
Yeah, and that's one of the components, and it's also social impact and how we're dealing with the full spectrum of equity, including with our own teammates. So we just actually had a meeting last week. We're very focused appropriately on inequities outside of our walls, but we asked the question, how are our own teammates doing? We certainly are proud of what we've done during COVID to embrace them and to make sure they had adequate support and help and things of that nature. But we also realized that there was a number of teammates that had some challenges with meeting their utilities, housing, transportation, et cetera. So we engaged in an effort, and we shared it through the board actually recently, where we really helped solve for them. There's a lot of community resources sometimes that are so hard to access, but they're there for food and for legal support, et cetera. And so I think we actually took an approach that it's not just outside our walls, but let's make sure that we put our teammates first and take the same sort of approach internally. And I think it's really yielded some really positive results early on, including on what you just mentioned in terms of just digital access. We asked all of our teammates, are you having any challenges accessing the internet or having the right equipment? And for those that did, then we were able to intervene directly and specifically to support them.
And do you find on the heels of COVID and George Floyd and just maybe more of a shift of a national conversation being a bit more, people being willing to engage more directly on these topics, is the nature of board conversations in your mind beginning to shift? And I'd love for you to draw upon not just Atrium's board, but you also sit on the board of Best Buy. So talk to me a little bit around how you're seeing the board level conversation shifting as it relates to equity and inclusion and starting to have some of these harder conversations.
What that's actually, to me, is part of the silver lining of this all. I mean, there's actually not a board that I serve on. I'm also the chair of the Federal Reserve, the Richmond Bank, and there really has not been one single board meeting that I've attended over this past year that the issue of equity hasn't come up. Certainly the Best Buy, I will tell you, is actually one of the most diverse Fortune 100 companies right now. And the richness of conversation has just been incredible. And obviously Best Buy has been very successful in terms of changing their business model and accessing, making sure that the customers were taken care of through this COVID thing. But I think it really, in order for this to be sustainable, governance has to play a major role. And I think that before this year, it was, I would say the approach was fairly uneven. But I think now I'm encouraged that conversation is happening, at least in any of the boards that I've been involved in. And I think that's really where sustainable change begins, because then the board can hold certainly the management for making significant progress here. And a lot of it has to be, I say that if you have structural racism and structural inequities, you gotta fight it with a structural approach. And that's embedded into organizations, including the governance and the administrative, and how people are incentivized. So I am optimistic. Obviously, there's a lot of work to be done, but I think those conversations can lead to real change.
I think that's right. I'd share the same reflection. Also, just we across the academy, so we work with probably 100 health systems and 100 industry companies. And this topic is, people want to talk about it. They want to engage. They want to figure out how to be allies if maybe they're not quite sure what that means practically. So I too am encouraged by the direction there. I do wonder, and maybe even how the sort of intersectionality of your military family, multiracial, international roots, leading a health system that has urban components and rural components. How do you think about this notion of meeting all of your stakeholders where they are? So when do you think about having a position on things that are happening? When do you think about maybe not having one? I just note that being a leader these days, especially with a national platform like your own, creates a little bit of maybe a question around how do you lead from the middle in times that still feel incredibly polarized? How have you yourself approached that? And
that's such a good question. Leading from the middle has been very, very challenging at times, because you want to have an inclusive orientation, but you want to call out specifically the things that are not reflective of who we should be as a community, as a nation. I would say, I guess I start giving my background and my experiences, that in the past, I really wouldn't even reflect internally on some of the challenges I've had with racism and things of that nature. And it really early on, one of my leaders over diversity and inclusion, she said, this is your time to really speak to the organization from that lens, so that, because it will open up, she said, the comfort level and create a safe space for others to tell their story. And so probably for the first time in my career, I really shared very specifically with the organization some of the things that I've dealt with, not because it was about me, but really to say, sometimes you perceive that CEO hasn't dealt with that. And let me just kind of share with you those experiences. Interestingly, I trace some of my family's roots to slave owners here in North Carolina, just from a couple hours from here. And really that those stories that you tell really have opened up, I think have opened up conversations. We also realized that when I first got here in 2016, there was a police shooting of Keith Lamont Scott, and that there was protest here in Charlotte. And I was trying to figure out, I wanted to understand what was underneath some of that. And obviously there were communities that had felt forgotten. So part of our mission was immediately to kind of engage with those communities. But in speaking to that, what I shared is that one of the things I'm proud of this organization is really our values. And so the values that we live inside of the organization let's go ahead and take them outside of the organization as well and model that, because during the protests here, we were taking care, obviously, of the victims and those were protesters, but we also were taking care of the police officers that were trying to keep people safe. And so that balance is important. We're here for all. And the importance of this is to call out the inequities directly when you see it, but also reflect that we need not just those people of color, we need allies supporting this. I will say that the biggest ally I have ever worked with, and I'm really blessed and fortunate that this is the case, is my board chair, Ed Brown, who helped Hugh McCall put together Bank of America and also was CEO of Hendrick Motors for the last decade. Just retired, and he grew up in Savannah, Georgia. And I got to tell you, he is such an all-in ally that certainly also just helps me think about things and pushes the organization to continue to be our very best during these times. So I think, and with that type of support, there's really a lot of opportunities for you to speak to the organization in a very direct way. The thing that helps here is that we're oriented towards that. I mean, we talk about our mission being for all. It's really what motivates people. So there's not a whole lot of cultural transformation that needs to occur for the teammates here, the 70,000 teammates we have here, to know that this is who they are, this is who they want us to be. And so that I think is fertile ground to continue to have those type of conversations.
I think that's right. I similarly, I agree. Power in personal storytelling. And I think as leaders, we've all been on this journey of maybe being more open to sharing those experiences that really shaped how we show up. And I think that's where you start to get, you build more trust with people. You get folks really wanting to be sort of called in and help really be an advocate and problem solver around it. And at least for me, it's been a journey in terms of my own comfort level and speaking my truth, right? And not necessarily wanting to, or maybe being a little bit sensitive earlier in my career to just maybe not yet having the comfort or the confidence in the story that sort of shaped me. So I do think, and I've been noting this from a number of our members and just broadly, that it does make it a lot easier for our team members and colleagues to show up when we're willing to lead with that.
That's so right. The thing I would though add to what you said is that I think, and I've probably had more podcasts on the racial situation than I had in my entire career. I think though people realize that, Renee, at some point people will say, okay, where's the action, right? And so what are these stories and leading to? And I think that goes back to really organizations need to have measurable goals in terms of how to make this difference. And that's really, first have to have the conversation, and then you have to have really the real meaningful, sustainable action. And I think that's what certainly we at Atrium are committed to.
That's great. All right. I want to change gears slightly and go back to lessons that maybe you picked up from serving on Best Buy's board. So coming out of COVID, I think most organizations that we speak to are really looking to be easier for a consumer to access. I think the consumer expectation around the ease at which they are able, ease and maybe preference on how we access all other parts of our experience, oftentimes healthcare does not meet that bar. So talk a little bit around maybe how the consumer products world that Best Buy lives in, the omnichannel approach that they've had to really embrace. What are you picking up from those conversations that you think are applicable to healthcare?
Yeah, I think, first of all, a company like Best Buy, I've just been really, really impressed by how they managed through this pandemic. But you highlighted there's a lot of lessons that I bring back to sort of our organization. You just highlighted the omni-channel approach. So it's not just about online, but it's having the right bricks and mortar in the right areas, because a lot of times that's how you define part of your brand. And I think healthcare, we've been as a field a bit slow on the online version, the digital part of it. But I think it's important to recognize as we continue to telehealth and other things advance the field on that end, we still are going to need other access points, both fixed access points and also mobile access points. So and they've made it work very, very well. I think Best Buy also has an obsessive customer orientation. And so, and they journey map just about every experience that a customer has. And I think there's more opportunities for us in healthcare to do just that, to really put ourselves in the shoes of a patient or customer, consumer, and say where are the barriers from the time that somebody is concerned that they may have cancer to the time that they actually contact a hospital or physician office all the way through. So I think this obsessive consumer or customer orientation is something that we can all learn from a company like Best Buy. And then the ability to leverage capabilities and expand them. Geek Squad is well known within Best Buy, and they come into your home and they help you with hooking up computers. And I use them often for my 80-year-old mom that lives outside of Philadelphia. But when you think about care at home, well, those Geek Squad who are trusted, they're trained, and they gain the confidence. Well, how about we use them to also help with some of the healthcare that's needed at home and working in partnership with others? So I think leveraging those existing assets, but expanding sort of the concept are some of the things that I've taken away from my experience on Best Buy.
I think the Geek Squad is a great example. What struck me about that too was just this extension of their capabilities, right? So, Best Buy using that as a way to maybe even break into a new space and as part of their own company's transformation. I thought that was a really interesting pivot in terms of how they approach that.
It really is. And then the other thing, just we're in communities through Best Buy, teen tech centers. I remember being one in Minneapolis, and so you have these tech centers that really take kids that are in high school and they bring them in. And I remember one young man was for the first time, he was a musician, so he was learning technology by doing his own video and things of that nature. And so the engagement of teenagers and teens in vulnerable communities and exposing them to other things, and then leveraging that as part of the workforce of the future. I think that's another thing that I think is one of the things that I really appreciate about the mission of Best Buy. You think as a consumer electronics company, et cetera, but they really understand the impact that they can have on communities because they're in just about every community in the country.
That's powerful. The workforce development angle is really powerful, just in terms of broadening the pool of competent workers that we all can draw from. That's great. Is there anything around governance best practices that you note in corporate boards that would be relevant for health systems? Is there anything that's different in those settings that you've tried to transport back to your own organization?
The one thing that comes to mind, I think, at least through the Best Buy lens and what I try to do more at the feds is creating a little bit more time for just sort of blue sky conversations. We recently had some conversations exactly on social impact. And sometimes we have so much going on in our health systems and things of that nature that we don't allow enough time for that conversation, because it's in that sense making that you also learn and educate and come up with something collectively that you might not as individual members. So that's the thing that comes to mind initially, Renee. I think there's some intentionality around that I've also used in our system as well.
Perfect. All right. Final question. Wrap up. The naming of this podcast, The Academy Table, was just meant to denote two things. One, just the power of getting different voices in the conversation. I think that can be transformative to our industry. And when I think about some of the most positive experiences for me personally, it's usually around a table with people that I care about. There's usually some great food and maybe some wine on the table. And so I think we're all looking forward to getting back to that time. So think about if you were curating your ideal table and you could invite any two people to that conversation, who would you choose and why?
That's an interesting question. One that comes to mind is actually Stevie Wonder. I'm a musician myself and sort of feel like I grew up with him as part of the family, but not just an amazing musician, but he also, he, like Marvin Gaye and others, really used that musical platform to talk about larger society issues. I remember when Martin Luther King's birthday became a national holiday and how much he worked on that. James Brown also worked on that. So I think, but Stevie Wonder is somebody, I have actually had a chance to meet him a couple of times, but he's just, I think from that perspective, is somebody who I've always felt that was phenomenal what he did, but also used his platform for good purpose. And then we just lost John Lewis. I think he'd be the other one that I would want to spend time with, because just he devoted his whole life to the cause, if you will, and it was all in, and also was not embittered by the battle. He was such a gentle soul and lived by example And it's such a sad thing to have lost him, but I think the legacy and what he represented, especially during these times, lives on. And it's just, I would want to ask him questions and learn more about how he came to do the things that he did. So I guess those would be the two that come to mind.
That's a great table. So now I have to ask, since you mentioned your musician roots and meeting Stevie Wonder, did you get a chance to play at all with him? And what's your instrument of choice?
My instrument's guitar, and I've written music probably for the last 30 years and actually recording an album as we speak of songs that I've written. But no, I never got a chance to play with Stevie, but in the band that I currently have, I have pretty notable figures, including a trombone player ran James Brown's band for a decade before he passed. So I've got some really good players with me, and that to me. And we've talked a lot about mental health of our community and our teammates and employees this past year for good reasons. I think leaders need to find what kind of gives them balance too, and that's been part of what I've shared with my colleagues is music is what really gets me away from things and allows me to get some joy and some peace, if you will. And so I share that whether it's you're an artist or whatever you do, that leaders should embrace that artistic or creative side of themselves to bring balance, but also I think it makes you a better leader overall. So that's the way. That's sort of how whenever I get a moment here or there, that's how I spend my time.
That's fantastic and impressive. That with all that you've got going on and just the life that you lead, that you carve out the space to write an album. So I look forward to learning more about that. I don't know. I got to find what my talent is. I don't know if bad karaoke would count in that.
I think there's no judgment on what that is. It's whatever brings you happiness.
All right. You don't have to be good at it. You just have to practice it.
Exactly.
Fair enough. Well, thank you, Gene. Such a pleasure to catch up with you today. I really appreciate you joining us.
Thanks for that. I appreciate it as well.
Take care. Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.